Good afternoon, and thank you for joining us this afternoon. Um, we were not scheduled to hold a media briefing today, but with Thanksgiving approaching and our case numbers again continuing to climb, we felt it was critical to meet with you and let you know where we are and stress the urgency of this moment. As we mentioned the other day, we are at a critical time in our fight against this pandemic. After leveling off earlier this summer, coronavirus is a surging again, and it's something we need to immediately deal with. Right now, this pandemic is a runaway train that is barreling across our nation and across our state and across our county, and we need to slow it down. That's why today we're announcing an enhanced enforcement effort with our public health order throughout our San Diego County region. This enhancement will bring together our county sheriff's department with our county compliance teams that have been working to educate businesses and residents about the need to follow the public health orders. Deputies will go out with our compliance teams and will be prepared to issue citations against those who are not cooperating. Our primary action will be to educate and to seek voluntary compliance. But when that is not possible, and we come across egregious violations or reckless disregard of the public health order, we will have no other option but to enforce. We have had discussions with our district attorney, Summer Stephan, and San Diego City Attorney, Mara Elliott, and they are prepared to follow up on those citations. This effort will be region-wide, and I urge our local cities to cooperate with us. And our county compliance teams are certainly already working with cities to educate and enforce. I would like to note that in my district, in the city of Chula Vista, they are stepping up their enforcement of cease and desist orders as they see their cases rise. And I certainly want to thank Mayor Casillas-Salas for her leadership on this effort. Look, we know that we all want to see this pandemic end. And believe me, we do too. But those who flaunt the public health orders, those who refuse to wear masks and facial coverings, are just prolonging the misery. The more we ignore safety measures, the longer this pandemic will go on. We're going to hear more about the enhanced enforcement from Sheriff Bill Gore. Dr. Wilma Wooten will be available to answer questions, but right now we'll hear from Supervisor Nathan Fletcher.
Thank you, and good afternoon. Across San Diego, we are seeing significant increases in our case counts and significant increases in our hospitalization. This is cause for great concern because although our situation is not as dire as many other states are facing, it does represent exponential growth and something that we have to get under control quickly. The nature of COVID from the very beginning is as it begins to spread and be much more prevalent throughout the community, you can have exponential growth. Which can lead you to a situation where it is possible that you can't overwhelm your healthcare system. And that is why you see so many actions and so many steps being taken. We know that the state of California has just announced essentially a curfew for purple tier counties, limiting activities from a non-essential nature from 10 p.m. Until 5 a.m. I think this is another step in an ongoing effort to try and battle COVID and ensure we can get through this in the best possible position for our state. Here in San Diego County today, we're announcing changes to our enforcement posture, increased efforts around enforcement, again, out of an attempt to try and slow the spread. No one wants to be punitive in any way, but the simple reality is our case counts are rising at an unprecedented rate. We went from a period of time where we were routinely having 200 to 300 cases to a time where now we have daily totals approaching 1,000 cases, one day exceeding 1,000 and approaching 1,000. We're also seeing fairly significant increases in our number of hospitalizations. As you'll see in a minute, we've had a doubling of COVID-related hospitalizations in the last 2 weeks. These are trajectories that we need to change, that we need to begin by slowing the spread, understanding there will be a lag. We are likely to see even If we have widespread compliance with public health orders today, we are likely to see increases for the coming days and weeks because of the lag, but we have to start now, and we have to take this action now. I would also remind everyone that the state of Iowa, which has roughly the same population as the county of San Diego, is experiencing a situation of over 1,500 COVID-related hospitalizations. That's 3 times the number that we have here. Their number of deaths is twice as high as ours. That's the situation that we are trying to avoid. We know that it could happen here, but because of our early interventions and actions, because we try to take steps early to try and slow the spread, and because we recognize when things start going out of control, we have to move quickly, we're hoping to avoid a situation that would be as severe as that. A part of that is enforcement, enforcement of the public health orders. We recognize and know that the overwhelming vast majority of San Diego individuals and San Diego entities are complying with our public health orders. But unfortunately, the overwhelming majority who are doing the right thing still have to pay the price when individuals are in blatant and egregious violation of public health orders. Earlier this week, we announced a stepped-up effort around cease and desist orders. Since Monday, we have issued 52 cease and desist orders to entities that are in blatant and willful violation of public health orders. These are posted on our county website. Dr. Wooten previously sent a letter to local law enforcement agencies asking for increased assistance, asking for help in enforcement of these. Yesterday, Supervisor Cox and myself met with Sheriff Gore, who's here today, to talk through what it is we might do together to help ensure compliance and enforcement, again, of those egregious violators. We appreciate Sheriff Gore stepping up. The sheriff you'll hear from in a minute is going to assign deputies that will be dedicated to our public health efforts. They will be there on hand to go out with our public health teams when they serve cease and desist notices. They'll coordinate with local jurisdictions that are willing to be partners, but they will be on hand countywide to issue citations for entities that make a choice to continue to be in blatant and willful violation of the orders once they've been served a public health notice. And we appreciate the Sheriff's Department. We appreciate their willingness to go throughout the county and to any jurisdiction if needed to ensure a standard level of compliance. We also spoke yesterday with District Attorney Summer Steffen. She is assigning a deputy district attorney to the public health team to be the liaison, and she has committed to ensuring appropriate enforcement of any citations that are issued. In the city of San Diego, the citation enforcement would go with City Attorney Mara Elliott, and I spoke with her yesterday. She is also dedicating a deputy city attorney to be the liaison with our public health teams, and has likewise ensured that appropriate enforcement of any citations issued in the city of San Diego will take place. With this team and these steps, we think we can move more swiftly and to ensure adherence to the public health orders, again, out of a desire to slow the spread, out of a desire to prevent extended lockdowns or more restrictions, and out of a desire to save lives and help guide our region through this. Going forward, the enforcement process will be as followed. When a complaint from the public is received that identifies entities that are defying public health orders, the county will investigate and see if it is appropriate to issue a cease and desist order. When it comes time to issue that order, our public health officials will be accompanied by a sheriff's deputy and perhaps a local law enforcement entity if that jurisdiction is cooperating, and they will show up, serve the cease and desist. If the entity does not want to come in compliance, they will be issued a citation, and at that point the district attorney or city attorney, if in the city of San Diego, will take it from there and ensure appropriate follow-up on enforcement of the citation. As Supervisor Cox mentioned, we want to give a special word of thanks to Mayor Mary Salas of Chula Vista and her public safety team that have been doing incredible work down there, along with people throughout the county that understand what is at stake for our region and what we have to do. To reiterate, if someone wishes to file a complaint, anyone can call our number at 858-694-2900, or they can email safereopeningcomplianceteam@sdcounty.ca.gov. Again, all of the actions that are being taken are designed out of a spirit of avoiding a situation getting exponentially worse. We know that indoor settings with non-household members are the most dangerous and present the highest risk. At the start of the pandemic, in July, when we had a spike, we came in and took similar steps, and we were able to significantly lower the curve, descend our case count, and get back in a more solid position. We know that we have to do the same moving forward. It is even more concerning as we head into the holiday season, a time that so many of us enjoy and look forward to a time where you can be around folks, your extended family and your friends. Normally that is what you do and what you look forward to. This year presents unique challenges. CDC has issued strong guidance advising against traveling. And I think this is particularly important for San Diego County residents when you realize that many states around the country are in a COVID situation that is much more dire with higher rates of transmission and spread than what we face here in San Diego County. And we are strongly encouraging residents not to travel, to avoid family members traveling from other parts of the country here, and for this 1 year at this one unique time, to celebrate the holidays with your household members, to do everything that we can to lower the spread and lower the transmission. It is not every holiday moving forward, but for this season, between now and the end of the year, we have to come together with a great sense of commitment to doing our part to get us in a stronger position so we can begin the year in a much solid position and hopefully look forward to the arrival of a vaccine and the beginnings of a pathway out of this. So again, we recognize the actions the state has taken today around a curfew for non-essential activities. We think this is an important component along with the enforcement of the public health orders that are out there. And we ask for the public's continued patience and vigilance and help as we get through these very difficult and trying times today. Before we hear from the sheriff, I want to update you quickly on the broad strokes of our case counts today to give you a sense of perspective of what we're dealing with. To begin with, on our T3 chart, you'll see our testing numbers continue to remain very, very strong. And we are going to continue to work to bring in resources and staffing, whatever it is we need to do to ensure that we can keep our testing numbers high. The 4.9 on percentage of positives, this is a significant jump from where we were just a few weeks ago. And every one of the metrics we look at, whether it's cases, percentage of positive, health equity, hospitalizations, are all showing significant signs of increase, which is concerning. On the next chart, you'll see our turnaround testing times. Again, a slight slowdown here with a few of these. We were going 1 to 2 days. We've added, there's about a half a day add on the county Helix partnership along with the hospital turnaround time. State walk-in labs are having some challenges, but again, the things we control as a county is our public health lab, our Helix partnership, and we continue to turn those around as quickly as possible, and we will do everything we can to ensure that we continue to turn those around swiftly. The next chart, I think, represents in a lot of ways the situation we're facing. That purple line there is the 14-day average. Again, that is smoothed out over a 14-day period for percentage of positive, and you can see the upward trajectory of that line. Today, we're reporting 899 new positive cases. Yesterday, 972. Day before, 700, 800, and 1,000. And if you just look back a few weeks ago, you can see when those numbers were routinely in the 200s and 300s. So a significant jump in transmission, and it will take great effort and time to slow this and bend it. The next chart you'll see on hospitalizations, again, you see the increase that we're seeing. And it is important to reiterate that you look at between a 21 and 24-day lag between an increase in cases and an increase in hospitalizations, which means the increase that we are seeing here in hospitalizations is not attributed directly to the increase in cases from the last few days. This is from an increase that started many weeks ago. If you just go back to the 24th there, you see we were at 214 COVID-related hospitalizations. Today, we are essentially double that number by the 18th. And this is what is concerning, and this is what we have to take action to slow the spread so we can have the impact of slowing the hospitalizations. Next chart, you see our COVID-related hospitalizations relative to total hospitalizations. And again, we have a little room here to go in terms of our hospital system capacity, but because the delay in impact, we are likely to see these numbers continue to rise for the next several weeks and perhaps longer. And then our ICU utilization and occupancy, again, you see the increase in COVID-related ICU cases in the blue bar, and then the orange bar representing the total numbers. And again, when you get to 73, recognizing this number could continue to climb. This is why we are continuing to take all of the actions that we are taking. With that, I want to turn it over to Sheriff Gore. And again, I want to reiterate my appreciation and thanks to the sheriff. A lot of folks are doing a lot of things they would rather not be doing. And we know law enforcement has a difficult job. They have a lot of tasks in front of them. And their willingness, the sheriff's willingness to dedicate deputies specifically to the purpose of working with our public health teams, we believe from a public health standpoint will help ensure broader compliance. And we are grateful and appreciative of their efforts to help us in this. So, Sheriff?
Thank you, Supervisor Fletcher. Well, as has already been stated, the Sheriff's Department is going to make a full-time commitment of deputy sheriffs to work with the county's safe reopening and compliance task force teams. Hopefully, by adding this full-time law enforcement presence, we will stress the importance of compliance with these public health orders. These teams will work throughout the county, all 18 cities and unincorporated, and they will consist of 4 two-man teams, two-man deputy teams, working with the different compliance operations around the county. We've already reached out to our local counterparts and have got cooperation from Oceanside Police Department, Carlsbad, City of San Diego Police Department, Chula Vista, and Coronado that advise us when we're working with these teams in their jurisdictions that we should reach out, and they will send officers to work with our deputies. I think, as in the past, it's important to note these teams will, when they go out, they're going to try to get the voluntary compliance and educate the business owner or whatever the entity is we're dealing with. And when we don't get that compliance, when we can't mitigate the situation that we're dealing with, that's when deputy sheriffs are there to take enforcement action, either through citations or writing case reports to go to the district attorney, or in the city of San Diego, the city attorney there. I think it's important also to note that we're not going door to door out there. There's enough complaints. These enforcement operations are complaint driven, either with calls from citizens to 211 or to law enforcement's non-emergency numbers around the county. So again, it's just a matter of all of us pulling together, getting through this very difficult time. We don't want to have to take enforcement action, but we will if we can't get that voluntary compliance with these very, very important public health orders. Bottom line is, wear those damn masks out there, socially distanced, and the sooner we do that, the sooner we're going to get through this crisis. So thank you very much, and I'll turn it back to Chairman Cox.
Thank you, Sheriff Gore. And again, we sincerely appreciate the Sheriff's Department cooperation in this very difficult time. We'll go directly to the questions now.
First question is from Matt Hoffman with KPBS.
You guys talked about blatant and willful violators, egregious violators of the order, but some believe, who aren't in compliance, believe that they aren't in compliance, say that these cease and desist orders they believe are coming out of nowhere. Urban Mo's, Bar and Grill, and Hillcrest, they were issued ones what the county says operating indoors. They say their patios licensed by local and state officials, and that county staff have seen their setup before when indoor operations were closed, and they didn't shut them down or say anything. So with that in mind, when you believe a business is not in compliance, are you contacting them at all, giving them a chance to work with you to correct perceived issues, or are you just sending out these cease and desist orders, closure orders?
Okay, I'm going to ask Gary Johnson, who's our Chief Compliance Officer, to respond to that.
Good afternoon, everyone, and thanks for that question. Absolutely, our first step typically is to reach out, either by phone or even pay a visit for any allegation of any wrongdoing or anything that is not considered compliant with a public health order or even state reopening guidance. Once that is done, then it can escalate, as Supervisor Nathan Fletcher said, with respect to cease and desist orders. Ultimately, there can come a closure order if required. The goal is never, ever to get to that point. The last thing we ever want to do is interject any type of law enforcement in these cases to begin with. If there's any questions, concerns, there's plenty of places on our website, even to the reopening team of which I lead, to try to work and clarify any questions, any concerns that anyone has about what is supportable, what is unsupportable with respect to public health orders and the state's guidance on reopening. So again, please leverage the resources that you have through me or my folks, and hopefully we'll get to a good place before we have to go into any type of compliance situation. Thank you.
Gotcha. And then in relation to the deputies with the compliance teams, you all mentioned working with some cities, whether they like it or not. Can you confirm that deputies will be going out to places like El Cajon that have made it very clear that they're not going to be enforcing the orders? And do you foresee any issues with that? Also for Sheriff Gore, as it relates to enforcement, what sort of change? You know, we had these orders for months. Why start doing a heavy-handed enforcement approach now?
Well, the first question, thanks for that question. we've reached out to our law enforcement partners in the county, as I stated, and have got the commitment from 5 of them to work with us. We would like to get compliance from all our chiefs, but if they're not going to join with us in enforcement actions, if that becomes necessary, we will issue those citations by ourselves without their assistance. The last part of your question was what?
Oh, sorry about that. The last part was about, as related to months, we'll start doing a heavy-handed enforcement approach now as opposed to earlier.
No, as I've stated many times in these types of conferences, we've already issued 159 citations around the county. This is not our first effort in this area, but I think it does magnify the issue we're faced with now with the numbers going up, our hospital populations increasing. I think it's appropriate that we portray or we send the message this is a significant problem and enforcement action will be taken if it's necessary.
Thank you.
We'll go to the next question now.
This next question is from Melissa Adan with NBC7.
Hi there, good afternoon. I have a two-part question regarding the state-issued curfew. Can you guys help clarify what this means for San Diego County and what is considered a non-essential business and how we're going to be enforcing this?
Okay. I can answer part of that, and I'll maybe call for some help from Dr. Wooten or others. The public health order that was just issued by Secretary Galley, Secretary of Health and Human Services, will go into effect on Saturday, and basically it doesn't have any impact on restaurants in San Diego County because they already have been subject to a previous county public health order to be closed by 10 p.m. Obviously, they have to be focusing on outside service now. This public health order will go into effect at 10 p.m. on Saturday. It will run through 5 a.m. on December 21st. It will stay in effect as long as we are in the blue tier. If we are fortunate enough to get out of the blue tier, then we will not have to comply with that under the Secretary's public health order. I was on a conference call with him just about 45 minutes ago, and he had a very sobering statistic that he threw out, and that is that somebody that gets COVID today, there's a 12% chance that in 2 weeks they will be admitted to a hospital. That's pretty sobering, and I just saw an article indicating that in LA County they had 500 cases just yesterday, and we've seen our cases going up. So this is a serious issue. It's one we all need to work on together. Does that answer your question, or is there more to it?
Thank you for the first part. So then the second part, it also mentions about personal gatherings. How would that be enforced?
Okay. Supervisor Fletcher is going to respond.
Thank you. I think the aim and intention of what the state's doing, when we went into the purple tier, that obviously closed indoor operations at a few entities that are highest risk. But as we pointed out when we went into that, there is widespread community transmission, and it is happening across the board, and a lot of it is happening at gatherings at private residence. And I think that the curfew order that the governor and the state of California have put in place, to read it directly, requiring that all gatherings with members of other households and all activities conducted outside the residence, lodging, or temporary accommodation, which with members of other households shall cease between 10 p.m. and 5 a.m., except for those associated with the operation, maintenance, or uses of critical infrastructure required by law. This is an attempt to have everyone understand the severity of the situation we face and to try and gain a wider spread appreciation of the danger that gatherings of multiple households together pose to the state of California. And so I think that the vast majority of folks will hear this, will understand this, and will understand we're doing this to protect the entire region, to protect the entire state. And so hopefully it will, by putting in place a public health order saying there are no gatherings of multiple households together, be it between 10 p.m. and 5 a.m., hopefully we can begin to see the decline in the number of cases associated with these types of gatherings.
I need to correct maybe one or two comments I just made. It's actually in LA County, they had 5,000 cases yesterday. We had, on Sunday, we announced we had 1,000 cases. We're about 3 times the size or 1/3 the size of LA County. So we can see that this is a growing problem, and again, our numbers have been going up, so we ask everybody's help and concurrence. We have one more question, I believe, that's been called in.
This next call is from Paul Sisson with the San Diego Union Tribune.
Thank you. I had a question about jurisdiction. So what we've heard at these meetings previously, and pretty recently, I think, is that the county health department has been unable to do a lot of citation beyond cease and desist orders or shutdown orders because you need the cooperation of the local jurisdiction. What I just heard the sheriff say, I believe, is that even in jurisdictions that aren't cooperating with us, suddenly the county sheriff's department can now parachute in and start issuing citations, even if that place has a local police department, say El Cajon or what have you. How is that possible? Can you tell us a little bit more about how this is suddenly something the county can do that it couldn't do 3 months ago?
Well, these are county public health orders, and we certainly solicit the support of the local jurisdictions, but the sheriff is here to respond to the balance of that question.
Thank you, Paul, for the question. We've always had the authority to do this, but I think that the problem has reached such a magnitude that now we feel it's imperative to do it. We're always stronger when we work with our local partners in the individual cities. If they're not going to work with us, we still will go in and issue the citations. Not that this is new power, we've always had the power, but now we're choosing to exercise it because of the magnitude of the problem.
I guess the follow-up question then would be, why not do this a couple months ago? I mean, we saw a big rise in numbers in the summer, late June.
Well, I think as we moved into the purple category, which put more restrictions on our businesses, I think that's driven the necessity to go into some of these cities that we have not been into before.
Thank you.
Sheriff, we have a couple of text questions related to the curfew. This first one is from Brandon Lewis with CBS 8. How will your department enforce the state's nighttime curfew for average citizens, not businesses, who may be out after 10 p.m. or attempt to knowingly defy the order?
I have to say, I just looked at this, I saw this state order about 10 minutes ago, and I've really not discussed it or thought through it, so I don't want to give you a premature answer without all the facts.
The second question related to the curfew is from Jacqueline Sarkisian with Fox 5. Again, she's also asking how you're going to enforce it, but she wants to also know if the restaurants that need to close earlier, will the restaurants need to close earlier so that customers and employees can get home by 10 p.m.?
Again, I don't think I've had the chance to really look at the magnitude or the exact wording of the order, and I would kind of defer that till I've had a chance to do some more research.
Thank you, Sheriff Gore.
This next question is raising the question I think all of us are dealing with, and that's kind of pandemic fatigue and how things are going to be dealt with over the Thanksgiving holiday. And I'm going to ask Dr. Wooten if she would please come up and respond to that question.
This question is from Christina Davis from the Union Tribune. People have been away from family and friends for so long and have COVID fatigue. How big of a test will Thanksgiving be for the county and rest of the nation, and what is the potential impact if people do not take precautions? What do you advise?
Well, thank you for that very important question during this time of the year. First of all, I'd like to acknowledge that we recognize that we've asked over the past 9 to 10 months, asked a lot of all of our residents, but we're asking more during the holiday season. And to get to that very last question, if we don't do the things that are being asked, we will see an increase in the number of cases as we've seen over the past couple of weeks. But in terms of what can you do, well, we recognize we just want households. That would be the most efficient way and the safest way for individuals to gather during the holiday season. Households only, having virtual Thanksgiving dinner with members that are either other families or friends that are local or out of state. That is the safest way, and we have actually a guidance document that was released for Thanksgiving a couple of weeks ago. Now, another option is, and I'd like you to adhere to this premise, small, short, and safe. So there's already the guidance about 3 households in terms of gathering. So that maintains a small number of individuals coming together. No more than spending 2 hours together, and then maintaining being safe, which means wearing your facial coverings when you're not eating, maintaining social distances, and also, if you are sick, do not go to that small gathering event. So those are, that's the recommendation that we are providing for individuals. Ideally, we want people to stay in their households and not gather. But if you must, adhere to the 3 household recommendation. And again, small numbers, a short duration, and then a safe experience with those that you are gathering.
Thank you, Dr. Wooten.
We know there's been a lot of very positive news over the last couple of days in regards to vaccinations and vaccines being developed and hopefully going to be distributed in the not too distant future. This question is dealing with the vaccination distribution plan, and Supervisor Fletcher is going to respond to this.
And this question is from Taryn Mento with KPBS. Can you detail what key steps the county is taking right now and what challenges you're still working through in terms of the eventual vaccine rollout?
Thank you, Taryn. As it relates to planning for the vaccine, the simple reality is there's a lot that we don't know. We don't know when we will get a vaccine. We don't know in what quantities. We don't know which one it will be. We don't know for sure exactly what the tiers or guidelines will be. However, we can't let those unknowns stop us from beginning to plan and prepare for multiple possible scenarios. In September, an internal county team began working on brainstorming and planning for a possible vaccine rollout or a probable vaccine rollout whenever it happens. There's been ongoing engagement with the California Department of Public Health, as they will probably be the entity providing most of the framework or direction in coordination with the federal government. Nick Machione has been leading our T3 efforts, testing, tracing, and treatment, is overseeing our preparation for this as a part of the treatment. And those efforts will continue ongoing. We want to make sure that we're being prepared for everything, brainstorming possible logistical arrangements, storage facilities, other types of things we could need. Planning out a robust communications effort to engage with the public when appropriate about who is eligible and where they can go and how that might work, and really preparing some public engagement. We do know that there is going to be pockets of reluctance who will have concerns about potentially getting a vaccine and how we can most appropriately engage in culturally competent ways and language appropriate ways to make sure that the public has access to information around it. And we're doing a series of dedicated collaborative efforts. We have a clinical team that is throughout our healthcare system and partners that will be meeting shortly after Thanksgiving to ensure that our healthcare systems, our healthcare providers, the county, that everyone is working collaboratively, as it could be a multi-pronged effort throughout each of those. And so that clinical advisory group will begin meeting. And we are developing community working groups to make sure we are working with community stakeholders and leaders from throughout San Diego County to make sure that there is sharing of information in a very transparent way around what is happening and what is available. And so right now, it really is a planning for multiple scenarios without knowing exactly what will come down and when it will happen. But we are very mindful that this is going to be an important piece of our COVID recovery effort, and we want to do everything we can to be prepared. In the coming weeks, we're likely to have more information, walking through things we're working on, timelines, folks that are involved. But we are taking this very serious and are working very hard internally to put us in the strongest position to ensure a successful vaccine rollout when that day arrives.
Thank you, Supervisor Fletcher.
This next question raises the issue of why are we focusing on enforcement so heavily at this time, and Dr. Wooten's going to respond.
This question is from Mike McKinnon with KUSI, and he's asking, why are you spending so much time on the enforcement of businesses and their closures when they are not the source of the spread?
Thank you for that question. So I want to point out that the comments or the content in the question are a bit inaccurate. The source of the spread is across all sectors, including businesses. It includes individuals that are gathering. So this virus is widespread. Every sector, every element of our community is impacted. So placing an emphasis on compliance is not something that we are just doing now. We created a compliance team several months ago. Now we are ramping up and enhancing compliance as well as testing with the increased number in cases and the surge in the number of cases that really are numbers that we have not seen ever in the course of this pandemic.
That completes our questions for today. As we stand now, we are not planning on having a media briefing during Thanksgiving week. However, we will provide updates as necessary. On Thanksgiving Day, we will have 3 testing sites that will be open: the Tubman Chavez Center, USD, and also Cal State San Marcos. Those are no appointment testing sites that will be open from 8:30 a.m. until 2 p.m. And again, if you have questions about other testing sites, you can get on our website, and you can be directed to that location nearest to you. You know, Thanksgiving is actually my favorite time of the year. It's obviously a time when we get together with our families, but this year in particular, let's make sure we enjoy it safely. And next year, we will be able to truly give thanks for surviving this pandemic. So we thank you for your attendance, and again, we'll be back not next week, but the week after at 2:30 on Wednesday.